that case.
Which actually turns to the second question in terms of the violence risk assessment. So in a scenario like that, or where you're just wanting to make sure that you're going to document properly, what are the things that one should be focusing on?
Okay. Um, in a violence risk assessment, uh, really the best single predictor of future violence is what we might all guess intuitively is past violence. It's a truism. It's a simple-minded way to approach it, but it's true. Past violence is the best predictor of future violence.
Okay.
Um, severe mental illness, particularly decompensated mental illness, is also a modest risk factor for violence in and of itself. There's been a lot of efforts on scholars to talk about the stigmatization of mental illness, that's really not the best predictor. And it is true that it's not, but we as mental health clinicians are going to be working with the mentally ill. And so it's important to recognize that decompensated mental illness can be a risk factor, but more importantly, history of violence. And if you ask me, young age, male gender, interpersonal violence is a young man's game. Substance abuse, that's another big one. And mental illness would fall down below all of those.
So especially in a dual diagnosed patient.
Yes, dual diagnosis, active substance abuse. There are other risk factors too that you could get into, which I teach in my forensic fellowship. But I'll mention here an instrument that a general practitioner could use that you don't have to be a forensic psychiatrist to use an instrument if you thought it rose to
like a risk assessment tool?
Yeah, a risk assessment tool would include things such as relationship problems that person's having, a particular strong grievance that somebody has about a particular individual, and that sort of relationship problem. There's an instrument called the HCR20. It's proprietary. You go to hcr-20.com and you can buy it. For free, you can look at the risk factors on the website. But I think it's a great instrument. I'm using it currently. It is intuitively obvious to a general psychiatrist some of the risk factors. This instrument, the genius of it is it has risk factors for violence, and it forces you as a practitioner to march through those various factors to consider them, and then you use your own judgment to come up as to whether you think the person's at risk or what level of risk. It has factors to consider, modifiable risk factors, such as are they willing to participate in treatment? Do they have personal support? It really doesn't require you to be a forensic psychiatrist to use that instrument.
There's 20 questions on there.
There's 20 risk factors.
HCR20.
HCR20. It's different from an actuarial guide, such as the Violence Risk Appraisal Guide, which has actual values attached to risk factors and gives you a probability of an event. For the general practitioner, the Violence Risk Appraisal Guide, I don't recommend it. It's better for persons like me in a judicial setting when you're considering release to parole or release from a forensic hospital. I think for the average practitioner, if you want to get into the structured clinical assessment, the HCR20 is the best thing we've got going. It's also, by the way, recommended in the best textbook on gun violence and mental illness by Liza Gold and Robert Simon, which is Gun Violence and Mental Illness. They recommend both those instruments, but the HCR20 for a person like you or the average clinical psychiatrist, that's the one you want to use.